What happened to my thing here? It's okay. The mother of an 8-year-old being treated for right lower lobe pneumonia at home calls the clinic nurse. The mom tells the nurse that the child complains of discomfort on the right side and that the ibuprofen is not effective. Which instruction should the nurse provide to the mother?
Increase the dose of ibuprofen now, increase the frequency of ibuprofen now, encourage the child to lie on a left side. They have a discomfort on the right side, encourage the child to lie on the right side. I would pick 4. That's where the discomfort is, and if the mother has a pneumonia and the child is being treated with lower lobe pneumonia. I think we tell them to lie on the same side, affected side, the right side.
Because when he has pneumonia, that means he got fluids and stuff in the right side. So I'm not sure.
I agree with 4, the right
Oh,
side.
let's do the right side.
Yes.
Okay. Why is this thing so big still? Okay, new parent expresses concern to the nurse regarding SIDS. She asks the nurse how to position the infant for sleep. In which position should the nurse tell the parent to place the infant for SIDS?
I think it's 4. Back rather than on the stomach.
Okay, I like it.
Guys, I'm here. I'm just in the middle of something, so I just put myself on mute. But I'm here.
Okay. All right, clinic nurse is providing instructions to parent of a child with cystic fibrosis regarding immunizations for the child. Which statement should the nurse make to the parent?
The immunization schedule will need to be altered. The child should not receive any hepatitis vaccination. The child will receive all the immunization except for the polio series. The child will receive the recommended basic series of immunization along with yearly influenza. Yeah, that's important for them, influenza and pneumonia. So 4. I think it's 4.
Everybody else?
I agree with 4.
Okay, good. The emergency department nurse is caring for the child diagnosed with epiglottis and assessing the child. The nurse should monitor for which indication that the child may be experiencing airway obstruction. So we talked about this last night, right?
Trapardia 2.
I like 2.
Okay, good. The child with laryngotracheobronchitis or croup is placed in a cool mist tent. The mom becomes concerned because the child is frightened and consistently crying and trying to climb out of the tent. Which is the most appropriate nursing action?
Child is frightened and consistently crying, trying to climb out, which is most appropriate. Tell the mother that the child must stay in the tent. Place a toy in the tent to make the child feel more
Give me 1
comfortable.
second, guys. Look at the question. I gotta make.
What
What did she say? What did she say?
I didn't hear. I
She
think she
said,
asked.
look at the question. Hold on, she has to do something. So just look at the question and then we continue when she comes back.
I'm torn between 2 and 4, but I'm leaning towards 4. I don't know. I'm not sure.
Tent to make the child feel more comfortable. Let the mother hold the child and direct the cool mist over the child's face. Child with Venturi Pancreatitis is placed in the cool mist tent.
Come here, I have one more. Oh, I'm sorry. Right there.
I would say because the child is scared, they're frightening. So I would say tell the mother to stay with the child because the toy might not help if they're scared in the tent. Call the pediatrician and sort of mild sedative. No.
Suman,
Yes.
can you read it in your head?
Oh, sorry. Okay.
Okay.
I'm sorry. I didn't even realize.
Sorry. Okay. What do we decide?
I think it's 4, but Judith was saying maybe 2 or 4, between 2 or 4. So you
I think I'd like 4 better. I'll go with 4.
Let the mother hold the child and direct the cool mist over the child's face. Call the pediatrician and get a prescription for a sedative. No. I know we do 2, but 4 might be more feasible in this case because the child's fearful. So let's see. I don't know the answer for this one, but good. 4 is correct. Let's look at your rationale. because the crying is going to put the child at risk for the laryngospasm. The mom holding the child is more likely to calm him down. So the idea here is to decrease the child's risk by not having him cry. The toy might not necessarily stop him from crying, but usually mama can. Okay, clinic nurse reads the results of a TB test of a 3-year-old. The results indicate an induration measuring 10 mm. The nurse should interpret these results as which finding? Positive, negative, inconclusive, or definitive?
Positive.
Positive.
Everybody agrees, positive?
Yes.
What happened? Okay, good. The mother of a hospitalized 2-year-old with virolaryngobronchitis or croup asks the pediatrician why they did not prescribe antibiotics. Which response should the nurse make?
I think it's 3.
Okay, I like 3.
I agree.
2's not true. Although we would want to be cautious with a young child, especially one that's an infant or younger. Why?
Say it again, Miss Sue. Sorry.
I said we would want to be cautious with antibiotics with a younger child, even though 2's not true. We would want to be cautious with a younger child. Why? Especially an infant. Why? Why are we cautious with them with antibiotics?
Because they can become susceptible.
Why?
Because their immunity,
No.
or they have a mother maternal antibodies.
No.
No, I'm not sure then.
So we have to be careful with them with the antibiotics because the kidneys are immature.
Yeah.
Because of the rapid transient of the GI system.
yeah.
Also, there's a delay in something else. I forget what it is, but the combination of those things, we have to be careful with giving them antibiotics, especially things like penicillin, digoxin, those kind of things.
Yeah, they don't have families and
2,
lipase.
1 is
also.
not the reason why we're not giving the antibiotics, because we don't know if the child's allergic or not. And 4 is not the correct answer. So I would probably say 3 is the best choice here because of that. But I really want to hear why you guys are picking the answers and why you're not picking the other stuff. And I want to hear like just some generic answer. When I ask you why, don't give me something generic because I already know the generic stuff. But what do you know deeper than that? Because generic isn't going to get you through on these exams. You're going to have to challenge your brains a little bit more than that. The nurse is preparing for admission of an infant with a diagnosis of bronchiolitis caused by RSV. Which interventions should the nurse include in the plan of care? So start with 6, okay? What interventions? If it's not true, don't pick it. So if our child had bronchiolitis caused by RSV, would we want to make sure that the nurse caring for the infant with RSV does not care for other high-risk children?
Yes.
Why?
Because it's considered like contagious, so they can pass it on to the other kids if they take care of the kids that already have the RSV. So I'm thinking that.
Okay. Everybody else agree with that?
Yes, it's not airborne, it's communicable. So
Well, regardless of how it's transmitted, we should be wearing PPE and hand washing our hands. So we shouldn't be transmitting diseases to other people. I'm not saying if it's true or false. I'm just saying that's a consideration that you have to have in mind as a nurse, because there are going to be times when you're going to have to take care of everyone on the floor. So that's why we wear PPE, is to prevent that spread. Just food for thought there. What about 5? Position the infant on the side with the head lower than the chest.
I don't think so. Head lower than the chest. No.
What's everybody else think?
I think that's false because it's not going to promote like breathing. So I think it's false. Number 5. I mean, it's not right.
Okay, it doesn't sound right, right? If it doesn't make sense, Judge Judy says it's not true.
That's right.
Okay. How about place the infant in a tent that delivers warm, humidified air?
Place the infant in a hut for RSV.
I think that's true.
I'm not
I
sure.
mean, that's right.
Okay, so some of you think that it's true. All right, so some of you think that 6 is true. And 5 is not true. 4 true. How about 3?
Yes. So that's the PPE.
How about 2?
No.
No.
And 1 is right. 1 is right too.
True.
Because you're going to
Yeah.
put them in isolation.
Okay. I probably would eliminate 4 because I feel like they would be in a cool, humidified air, not warm. And
Mhm.
other than that, I think that you have 100% here.
Okay.
Okay, so RSV is highly contagious. It's transmitted through droplets or contact with respiratory secretions. Use of contact droplet and standard precautions during care, wearing gloves, mask, and a gown reduces nosocomial transmission. In addition, it's important to ensure that the nurse caring for the child with RSV does not care for other high-risk children to prevent transmission of the infection. An infant with RSV should be placed in a private room, should be positioned with the head and chest at a 30 to 40 degree angle and neck slightly extended to maintain an open airway and decrease pressure on the diaphragm. Then cool, humidified air to relieve the shortness of breath, the hypoxemia, and the insensible water loss from the increased respirations. The nurse reviews lab results for a child with suspected diagnosis of rheumatic fever, knowing that's which lab study would help confirm the diagnosis.
That's 4.
4, the strepto titer.
No, yeah, that one.
Okay. All right, rheumatic fever affects the connective tissue of the heart, joint, skin, blood vessels, and central nervous system. Diagnosis is confirmed by 2 major manifestations, the Jones criteria, 1 major and 2 minor from the Jones criteria. Also evidence of a recent strep infection, which is done through that titer. Good. On assessment of a child admitted with a diagnosis of acute Kawasaki disease, the nurse expects to know which clinical manifestation in the acute stage of the disease.
Gray.
3. Somebody's reading. Everybody agree?
Yes.
Kawasaki disease, also known as mucocutaneous lymph node syndrome, is an acute systemic inflammatory disease. In the acute stage, the child will have fever, conjunctival hyperemia, red throat, swollen hands, rash, enlargement of the cervical nodes. Subacutely, cracking lips, fissures, desquamation of the skin on the tips of the fingers, joint pain, cardiac manifestations, and thrombocytosis. In a convalescent stage, the child appears normal, but signs of inflammation may be present. The nurse provides home care instructions to the parents of a child with heart failure regarding administration of digoxin, which statement made by the parent indicates a need for further teaching. So what do you guys know about digoxin?
It increases
Heart contractility.
it increases myocardial contractility. And you want to take the child's pulse before you give it, and you hold it if it's less than 90. And you want to watch for digoxin toxicity too when you administer it, the signs and symptoms.
Which
Yeah,
are
which are like anorexia, diarrhea,
Diarrhea, headache,
nausea, vomiting,
nausea,
changes, halos,
yeah, and low potassium.
cardiac
low potassium
glycoside.
too.
What precipitates toxicity?
Low potassium.
Low potassium.
Okay. So you already know the answer here then, right?
Yeah,
4.
it's 4.
It's not 4. Is it? Oh, yeah, it is. You're right, nurse, because Suey didn't read. I was just seeing if you guys were paying attention. Good job, because you were paying more attention than me that time. All right, so the nurse is closely monitoring the I&O of an infant with heart failure receiving a diuretic. The nurse should use which most appropriate method to assess the urine output? I feel like these questions are kind of easy.
Yeah, infant, we will weigh the diaper.
Wearing diapers.
How do you guys feel? Or you feel like they're hard? Are they challenging?
I wish they have exam like that. Yeah.
They might
I
seem
wish.
easier to you than they do to me. So let me just,
Yeah.
let me change up and see if I could give you a little bit harder questions and see how you do. I think I got to stop my share for a minute to put the questions up because I don't like the share probably. Come on. Sorry, it's not popping up for some reason. Let me try to log back into it. Okay, let me know when you can see it.
Yeah, I can see it.
Okay, a new nurse is assisting the new mother as she is breastfeeding her infant. The child is diagnosed with tetralogy of Fallot. During feeding, the infant becomes cyanotic and is having difficulty breathing. What should be the nurse's first action?
Oxygen.
Okay, what does everybody else think?
I like oxygen too, but buy a mask.
Okay, the answer here is actually 4. You're going to put the child
Yeah.
in the chest position
Because
first.
I was doubting too, because you say, I don't know. So I would have never picked 2 if I was doing a test. I would probably pick the knee chest.
Okay. All right, so the knee chest position for this child, okay, is going to help relieve. All right, first, and then you may have to use the oxygen after the fact if they're still having this low pulse ox. So they may become cyanotic. And where would you look for that cyanosis at? And what kind of things do you think would prompt one of these spells? So maybe the child is in the corner taking a poop. That could prompt one of these spells, or doing something that exerts some sort of extra energy. If they are going to become cyanotic, it's probably going to be like around the mouth, the ears, the fingertips, the nail beds. Mucous membranes. All right, but things that you'd be able to see right off would be those around the mouth and the earlobes. The nurse receives report on a group of clients. Which client should the nurse see first?
I'm thinking 2.
Okay. 2 looks like the airway's blocked. 3's talking about stridor, which generally means there's actually a blockage.
That's cruel. More like cruel. But the O2 sat is 94.
2 sounds like tetralogy of Fallot. I still am worried about that stridor in 3 because that's usually an obstruction. And actually 2 is aspiration, which I thought about at first, but then I went back and looked at 3 and it made me think that they might have been talking about something different there. So good job on that. All right, several children are brought to the emergency room after a boating accident in which they were thrown in the water. The children are now 6 hours post-admission. Which child should the nurse evaluate first?
And who did not. 3.
Mm-hmm. Wait, I'm gonna read 4. Yeah, I think 3. 3 is more, looks more serious.
Okay, good. Sometimes these babies can have what we call submersion injury. All right, where if they went underwater for a little bit of time, and actually I was just talking about this yesterday, they could have aspirated the water, and then we have to watch them for at least 6 hours because those respiratory symptoms can come back. So this child had a increase in the work of breathing, okay, and this is actually what's happening with them. All right, good. The emergency room nurse is admitting a 12-year-old who reports palpitations. Which action should the nurse anticipate? Can you see the exhibit?
Yes.
Yes.
Temperature is 97. Heart rate is 234.
Yeah, heart rate is really high. Okay. Edema. Okay.
Okay.
Yep.
Come on. I don't know why it's not closing.
Click on the question.
Click
maybe.
on it. Yeah. Oh. Oh.
On the question, maybe.
It's not.
Yeah. No.
Click on the vital signs again. Okay. It's not clicking.
Not epinephrine. No. Respiration.
Epinephrine. Epinephrine is for, I think epinephrine increases everything, so I don't think one is right. Leaning towards, I don't know about 4. So that heart rate was in the 200s, 234, I think.
So when the heart rate is up like that, the most immediate thing you can do is the Valsalva maneuver. That can slow the heart rate down. So you might
Was that
want to
the
try 3.
bearing down? Okay.
The tripod was for the airway. Epinephrine would have made the heart rate faster. That we usually give that for someone who has no heart rate. Okay, and if the heart rate is slow and symptomatic, then we use atropine, which I talk about on top of the pine tree. That's for when they have symptomatic bradycardia. All right, we give them atropine on top of the pine tree to bring the heart rate up. Tripod positions for the airway, and defibrillation would have been for either VFib or pulseless DTAC. Nurse auscultates a loud cardiac murmur on a newborn with suspected trisomy 21 Down syndrome. A genetic screen and echocardiogram are scheduled that day. The neonate's vital signs are shown in the exhibit. What would be an appropriate action for the nurse to complete next? Oh, let me see the exhibit, sorry.
Virus and just run Heart rate looks okay. Respirations are high according to. I think it's okay. Document the findings. It's a newborn, so I would pick 2.
Everybody agree?
Yes.
Okay. Nurses caring for a 4-year-old with cystic fibrosis who uses high-frequency chest wall oscillation vest for chest physiotherapy. After reinforcing education with the parents, which statement would require further teaching? So you guys familiar with this?
The
Yes.
test
I think it's a 1 because you don't want them eat while you're doing the physiotherapy.
Okay, good.
is done early in the morning before eating. Yeah.
Yep.
Definitely don't want them eating. 6-month-old is diagnosed with cystic fibrosis. Which of the following would be appropriate for the registered nurse to teach the parents?
Answer.
I think 4 is wrong because you want to do high calorie diet. So 4 is wrong. Place a child in a knee chest position during hypercytonic episode.
Yes. I don't think
I think 3. Hold on. More perform manual chest physiotherapy to teach the parents. 2 and 3 seems right for me, so I don't know which one to pick. I'm stuck
3 is
between.
for tetralogy of
Oh,
Fallot.
for lot. Okay, so it's 2 then.
so. Yeah, I agree.
Okay, good. Remember, they're going to have that excessive mucus production everywhere. GI, respiratory, cardiac, reproductive. Nurses teaching the parents of an infant with tetralogy of Fallot. Which of the following actions should the nurse include to reduce the incidence of hypercyanotic spells?
I think this is when you do the knee chest, right? I don't know. Promote.
And then frequently follow lungs into doing adequate walking.
Do it at least 1.
Smaller feedings.
Mm-hmm. What about 6? Frequently turning the baby during sleep.
Promote a quiet period upon walking in the morning. Well, after
Mm.
I would say offer the pacifier too, because in crying would increase the
Intracranial pressure or breathing or the workload of the heart. Maybe. How you call that thing? The work.
yeah,
Workload.
it increase the workload. Yeah.
So you want 3?
2.
2.
Not a quiet period.
Swallow the infant during the procedures. I don't know about 4. 4 is definitely wrong for me. So I'll just pick 1, 2, 3. Whew. Quiet period
Well,
upon
why
waking.
would we do 4?
So they don't cry.
If to prevent like them moving during, I don't know, because they say during procedures.
Well, when we swaddle the baby, we usually do that to comfort them.
Oh, okay.
I don't know about 3. I'm thinking that you might give them a quiet period. Like when they wake, they should be a little bit of energy there. So maybe a little bit later in the morning, or maybe after lunch, you might want to give them a quiet period. When they first wake, let them do the things that they need to do, because that should be sort of a more energetic time. I might be wrong on that, but I'm just thinking in general, like when we wake up, we're usually fresh, and also we do have to give them quiet resting periods, but I don't know about right after they wake up. I would pick 4 over 3 if I had to make the choice.
I agree with for 4.
Yeah, go with 4.
And if we're wrong, then we're going to learn something, right?
Right. Oh, okay. 5
5
is a
was
6.
incorrect, but 3 was good.
Oh, okay.
So a calm environment, particularly upon waking. It doesn't really say why, but
Mm.
oh, because that's usually when the TET spells occur. So that's why. All right, so that makes sense. The triage nurse is assessing an unvaccinated 4-month-old for fever, irritability, open mouth drooling. After the infant is successfully treated for epiglottis, parents wonder how this could have been avoided. Which response by the nurse would be most appropriate?
Immunization.
Why?
Because then they will have less risk for infection. If they have a respiratory infection, they can be prevented. Which response were the nurse was most appropriate? Yeah, I think it's immunization. We were still waiting for the formal report. Now there's nothing to be done. And it says it was an unvaccinated child, 4-month-old. I would say.
So, I mean, 2 is correct, or it should be correct. It usually is by standard immunizations, but it's because certain immunizations prevent certain things that are more associated with this, like the Hib immunization. The nurse is caring for a newborn with patent ductus arteriosus. Which assessment finding should the nurse expect?
That's 2. Loud machine like mama.
Patent doctor.
I'm sorry so much.
No, that's okay.
You will give you just the facts about it. The nurse is planning care for a child being admitted with Kawasaki disease and should give priority to which nursing intervention?
Food compression priority should be hot. So I would pick to heart rhythm because it can cause aneurysm.
Okay, what's everybody else think?
Judith?
You guys there?
I'm here. We only two of us. Thinking. I don't know. I was reading one little bit because think about the. I'll just go with two since it's like heart rhythm.
And decrease urine output, which could be
Yes.
actually indicative of heart failure.
Yes.
Okay. All right, let's try a couple of maternity ones on here real quick, and then I'm going to go into that, try to finish up that cardiac lecture for you guys so that it'll be recorded for you. Okay, so let's try a couple maternity. Okay, if it's something you guys aren't doing yet, just let me know and we'll skip it, okay? All right, so pregnant client arrives in the labor and delivery unit. Can you see it?
No.
I can
yeah.
see it. No. You gotta, I can see it. No, we're not able to see it.
How about now?
No, not yet.
No.
Yes?
Yes, we can see it now.
Yes.
Okay. A pregnant client arrives in the labor and delivery unit with mild contractions, brisk, painless vaginal bleeding. The client received no prenatal care and reports being about 7 to 8 months. Which actions should the nurse anticipate? Okay, so bright, painless bleeding. First of all, what are you thinking?
Placenta previa.
Previa. Yeah.
Okay, now what's the risk for this patient?
Fetal heart rate and also
Risk is a fetal heart rate.
yes, also she can
That's the risk. The risk for this patient is a fetal heart rate.
I mean, the
What is the risk for this patient?
Risk for what?
hemorrhage.
Hemorrhage.
And she has a hemorrhage.
Preterm
She's probably going to go into what?
labor.
Shock.
Shock.
Shock. I'm sorry, shock.
Okay. So that's what you have to think about, because this is what you have to treat. So how are you going to treat that?
Draw blood in case she needs a transfusion. IV test.
Encourage fluids too.
And
Blood
she need
draw.
IV.
2 is right too. I'm gonna monitor the fetal heart rate.
That's what I was reading when I
IV fluids. I think I'm gonna give him IV fluids too.
Yeah,
Hydration.
wants to assess the bleeding. Yes,
4
we
is
will.
good too.
No vaginal
I
examination.
don't know vaginal examination because of the previous.
Good. Okay, normal on the right, placenta previa on the left. I mean, normal on the left, placenta previa on the right. All right, so we have this baby that's in the wrong spot. All right, so we're gonna have either partial or complete covering of the opening of the cervix, painless vaginal bleeding. All right, so hemorrhage, and then you have to think shock. So you got to do things to prevent that. Okay. All right. The nurse is observing a student nurse care for a mother unsuccessful with breastfeeding. Are you guys doing breastfeeding?
Yes.
All right. Which action by the nurse would, which action by the student would require the nurse to intervene? So A, assesses the baby's position and sucking during breastfeeding. That's okay, right?
That's good. Yes.
Demonstrates to the mother how to use an electric breast pump.
I think that should be okay because she's demonstrating the technique of pumping.
Provides supplemental formula feedings until improved breastfeeding occurs.
I
Yeah.
think that's not right.
Okay.
Wow.
Shows the mom how to hand express breast milk.
That should be okay.
That's good. That's okay.
I
All
guess
right,
it's
so we're not going to do 3, right? We're not going to give them supplemental formula if they're breastfeeding.
Yes.
That's a no-no.
Mm-hmm.
The nurse is caring for a postpartum couple and notices that the newborn is cyanotic and apneic with a heart rate of 70. The nurse calls for help and begins resuscitation. Which position is appropriate for ventilating the newborn?
I think 4.
Okay, 4, the airway is not going to be in alignment, so you're not going to pick 4.
So
3,
maybe
the
1.
airway is
1.
hyperextended. All
What
right.
about 1?
We definitely would want to put a towel and keep the
I
chin
didn't.
neutral.
Okay.
1.
So it should be 1. All right, see the alignment you want there?
Yes.
Okay. The nurse is collecting data on a pregnant client in the first trimester. Which finding is most concerning and warrants a priority intervention?
Chronic hypertension. Client is taking the hypertensive medication.
What about 4? cramping. Oh, that's normal.
I think it's a
I should have one on the table.
lisinopril ACE inhibitor.
So
Why?
it's two.
Why is it 2?
Yeah, I think that they cannot take the ACE inhibitors during the pregnancy, and it's a chronic hypertension, so she needs to be monitored continuously for
Okay.
Or it can preeclampsia.
For the ACE inhibitor, because you can't take that in the first 13 weeks especially. So it's for the ACE inhibitor, not the hypertension so much. I mean, they are going to address that, but the issue is that the ACE inhibitor is going to harm the baby. No, baby, I want a water. All right, so ARBs, the sartans, and the ACE inhibitors.
Hemoglobin is low.
All right, let's look at your question. There's your exhibit. The nurse reviews the lab results of a laboring client requesting, thank you, epidural anesthesia. Which value is priority to report to the anesthesiologist before placing the epidural? Ah, shit.
Oh.
Well, that was a free one for you guys. Hopefully you saw that the platelets were low.
I was still reading. I was on hemoglobin. That's okay. I learned. I was platelet.
A nurse on the antepartum unit is caring for a pregnant client at 30 weeks gestation, admitted with reports of vaginal bleeding. The diagnosis of placenta previa was confirmed by ultrasound. What should the nurse tell the client to anticipate?
Additional ultrasound around 36 weeks. Clearance was stopped. Yes. And
Yes,
discharge.
but
Discharge when the clearance stops.
yes to which one?
Two, they cannot, yeah. I
Yes
don't
to
know
which
that.
one?
Number 2,
Clearance for sexual activity if bleeding stops?
No.
I don't think that would probably be true. It could be. I wouldn't probably pick that.
I think 3. What about 3?
I think 3 might be okay because we're not doing anything to the patient here. We could keep them on some bed rest,
Bed
send
rest,
them
yes.
home and keep them on some bed rest. I just feel like 2 would be too much trauma for this high risk pregnancy.
And you won't do vaginal
Third one.
exam. So I think 5 is 5. I don't know if 5 is.
No.
5 is wrong. So what about
4,
So I probably would say 4 and maybe 1. We might
1?
have some additional ultrasounds done.
Yeah.
I don't like anything else up there. And if we're wrong, we're learned, but I'm thinking for this is all we're going to do.
Yay.
yeah.
That's smart.
Okay, no clearance.
Just giving you guys a chance to read a little bit.
So I was thinking that that statement that they should have, like, before they have sexual activity, they should get a clearance from the doctor, you know, like, I think it was like the way I read it. There's the big stuff.
Okay, the nurse is caring for a group of 1-day-old clients in the newborn. Which finding requires immediate attention? Abdominal breathing with 15-second pauses in a sleeping newborn. Apical pulse of 190 in a newborn that's crying. A heart murmur in a newborn feeding appropriately. Respirations of 68 with grunting in a newborn post C-section.
Oh, that again.
Or I think grunt
Mommy.
Which one?
68 rest. 4. I think 30 to 60 is a respiration for newborn, so that's a little high. And if they're grunting, that should be.
I think it's 4 too. I agree.
Okay, I probably would be looking at 4-2 because of the grunting. It is slightly elevated. And C-section, they could have aspirated the meconium or something along that line. So, okay.
Okay.
Okay, good job. So the nurse is teaching a client about expected weight gain during pregnancy. The client's BMI is 21. Which statement by the client indicates an appropriate understanding about weight gain?
I should gain 10 to 15 pounds during the first trimester. I should gain total of 30 pounds during my pregnancy. That makes sense. I should gain no more than 0.5 labs per week during the trimester. I think it's 1 lab. If I gain,
I think it's 2.
yeah, so it's the only one makes sense there.
Okay, I should gain a total of about 30 pounds. So really what you're going to gain is based on what your BMI is.
Mm-hmm.
So
Her
everybody,
BMI is her BMI is little high, so she should, like, they should stay between 25 to 35.
35, yes.
That's okay.
so 2 is what you guys like?
Yes.
Tired.
Good job. All right, so anybody a little underweight, we would want them to gain a little more. If they're obese, a little less.
Yeah,
Good
she is in
job.
that range, 25 to 35.
Okay, the postpartum nurse is assessing a client who gave birth by C-section 5 hours ago and requesting pain medication. The client appears restless, has a heart rate of 110, and admits to recent onset of anxiety. What priority nursing action should the nurse take?
Assess the oxygen level because she's 5 hours post-op. Heart rate is high. She might have an embolism or bleeding. I would pick 3.
I think C, because at least you want to know. No, some. I'm sorry. I think you want to know the baseline of her oxygen level at least, because she did had a C-section. So I'll go with B, number 2.
So pulse ox,
Yes.
good job. All right, so she could have a DVT. It could have traveled to the lungs. That could be causing that anxiety and restlessness. And also those change in vital signs. Client gravida 4, para 3 at 38 weeks gestation arrives at the ER with strong contractions that began 1 hour ago. The client is diaphoretic, grunting and yelling loudly that she wants an epidural because she feels the need to push. What priority action should the nurse take?
I think it's one.
Okay, I like 1. If she feels the need to push, I definitely would want to.
She's probably 11. She's 38 weeks. So yeah. So I'll go with 1.
How about the heart rate? Because, okay, that's fine.
But it's saved via Doppler. So I don't know. We're gonna do that yet. I think you wanna say.
I think is. I'm sorry.
Go ahead,
Go
Beatrice.
ahead, talk.
No, I was thinking is A because now she actually screaming and yelling. She's sweating. She feels like she want to push. You know, so you want to see.
Pressure.
Yeah, I want to see because I don't think you have enough time to be checking heart tones and if she's screaming.
Okay.
I don't know though. That's what I think.
Okay. Good job. All right, if she feels the need to push, you need to be looking. Because women know. They know when that baby's coming. A lot of times people don't listen, but we know. Especially if it's not your first.
Just to Miss Loesch.
Yes.
I remember I went to the ER and I said that I need to push. And the guy was like, what is your social security number? I said, I don't know. Like, I really need to push. And she didn't pay me no more. The next thing I know, my baby was out.
Yep.
Exactly. So.
On my second too, I told them I'm ready. You better take me. And they're like, no, the doctor just said you're not ready. I'm like, I'm telling you, the baby's here. By the time they got me to the room, the baby was already coming. They had to wait on the doctor. The baby's already out.
I got afraid.
All right. The nurse is caring for a 6-hour-old full-term newborn of a mother with gestational diabetes. A bedside cap blood glucose reveals that the newborn's blood glucose is 45. The newborn is asymptomatic. What is the nurse's first action?
IV glucose.
What should the blood glucose be?
They tend to have a low blood glucose because they're increasing more insulin because of
What should the glucose be? Was my question. What should it be? If you're going to give IV glucose, what should the glucose be?
I don't remember.
I'm not sure about that.
So I'm going to say I feel like the glucose
45
is normal, or
is normal.
because I believe it's 40 in a newborn.
40. I think it's between 45 and 1. Yeah, so that's normal. Between 40 and 45.
Probably looking at either 3 or 1, but I'm kind of thinking about 3.
Oh.
3?
I'm only going to do 4 if the glucose is extremely low.
I don't remember the number. So.
All right, make a choice, nurse.
I'm not sure about the normal range. Judith said that it's between 45 and 1.
I think the book is, I read some, I'm not sure. I think it's between 45 and 126 or something. So that's normal, I think. So I'm thinking it's 1.
Okay.
See the newborn.
Good job.
Mm. Thank you, Joseph.
You're welcome.
So below 40 to 45 would be considered low.
Oh, okay. Now I know.
Again, you have to know, because if you pick an answer, then you pick the wrong answer.
Yeah.
And 3, why I was looking at the 3 is because sometimes if the baby is cold, it can cause them to be a little hypoglycemic. All right. Client is admitted to postpartum floor after vaginal birth, which finding indicates a need for immediate intervention.
Postpartum. Yes. Okay, that's okay.
Oh, yeah, yeah.
What about 2?
Vision? Yeah,
Oh,
I think it's 2.
Okay, I'll probably be looking at that hemorrhage on 1, but it might be 2. Let's see.
Is every 2 hours more consistent? Or that's
I
quite
feel
no?
like
I don't
that's a lot.
know. Okay.
So let's see.
Yay.
Eclampsia.
Since I did pad
You
changes.
just also hey.
Listen, I like it when y'all teach me something, so that's a good thing. Remember, this isn't my strength.
But you're doing pretty good. It's like you know most of this stuff. So I think
Exactly.
you're pretty good at it.
Yeah. You know that we need her in the room. That's, I think
We
my
do.
anxiety will be
Can you
decreased
come teach us?
because I don't do good in the exams where my anxiety is up. So I need Miss Sue in there.
The little knowledge that you have, Miss Sue, I think can really help us. So you can come and teach us.
Just
I
be
hear you.
there, Miss.
All right, so the preeclampsia there. Good job, ladies. Okay. The nurse is preparing to discharge a client following first trimester miscarriage. Which of the following statements should the nurse include in discharge teaching for the client and the partner?
Attending a support group with other people where the pregnancy can be helpful. Yes. Counseling, genetic counseling. Yes. One of the most important things you can do is not to communicate with your partner. The grieving period lasts.
So far,
1 is
I-
good.
yeah, 1.
True.
But I
How
think
about 3?
they do genetic counseling if you have like multiple miscarriages. So if
Yeah.
you only have 1, I don't think that's so 2 is no, not 2.
Hold on. Genetic counseling. Oh no.
I think you
I
say
don't
yeah
think-
for if you have like
couple,
multiple.
Yeah.
Yeah, miscarriages.
I guess also it depends on the emotional status of the couples, though. Some people will be broken by just 1. I don't know. But how about 3? No. I don't think 3. I don't think 3. I don't think 3.
Genetic hold on, never mind. It might last longer than 6 months, depending on.
Yeah, but I mean, how would you even tell somebody that the grieving period only lasts for? You don't know.
No, that's 4 is not
Just
right.
because it has only in there, I don't like it.
Yeah.
Yeah.
It's individualized. Some people
All right,
take long.
let's
I
choose.
think 5. 5 is wrong too.
Trying to conceive again. That's not your business. Like, I don't know.
She said that's not your business.
Okay, so 1 and 3 you like, right?
Let's try that. Let's see.
Yay!
Good job.
Yes.
All right, nurse is admitting a client at 41 weeks gestation for induction of labor due to oligohydramnios. All right, so lack of that fluid, right?
Yeah,
Amniotic
amniotic
fluid.
fluid.
Consider the client's indication for induction. What should the nurse anticipate?
I think it's
Hmm.
2. Oh, wait,
Uh,
no, wait, no, I take that
Okay,
back. No,
I'm sorry. Go ahead, Judy.
I'm still thinking. You go ahead.
I was thinking I was thinking it could be 4 because if the pregnancy is going to be induced, this woman is at risk for hemorrhage, for postpartum hemorrhage.
But she's post due, like she's past due.
Yes, but they're still going to induce it though.
They're doing induction. That means they're doing it like
They're going to
inducing the.
induce it, yeah. I don't know.
So
That's
you
what I
think she's
think.
at
So
risk
it
for?
could be
You think?
4. I'm kind of leaning towards 3 because I'm thinking without the fluid that the baby might be a little stuck in the canal without the lubrication and all. But let's see what your thought process brings us, Judith.
I agree with Story too, and also because they need some help when they
Oh,
Ah,
it was 1. My goodness.
additionally.
is that like a do? What is that? So they need more people to get the baby out just because they're postpartum? I mean, I don't know.
Well, more complications maybe.
Oh,
Okay, got it.
So they have extra people there to help.
okay. Like extra professionals. That's what they mean, right?
Mm-hmm.
We learned something.
Absolutely.
So risk for umbilical cord compression and pulmonary hypoplasia. So additional people for resuscitation and evaluation. A pregnant client at 30 weeks gestation comes to the prenatal clinic. Which vaccines may be administered safely at this visit?
Influenza.
So 1,
Influenza.
You got
3.
1 or 2.
Oh,
Both.
I'll go with 1.
1 and 4
Why not 2?
nasal spray.
Um, hmm.
Nasal spray. But I'm thinking.
Let's see.
1, why don't you give 2?
It's invasive because it's invasive.
Well, 1's more invasive than 2.
Yeah, that's what I'm trying to think.
I'm gonna shove up your nose. So really, 1's more invasive than 2.
So let's do 2.
Why wouldn't you do 2? You're not gonna do 2. What else are you not gonna do?
You want to give them mumps and measles, mumps and rubella or
Yeah,
worse.
3.
How about
Gonna give them 3?
No, you're gonna give them
No.
number 4.
Oh,
Yeah, we're
okay.
gonna give them 4, no 3
4.
or no 5.
No
And
5
no 5,
either.
okay? 2's
Yes.
live, okay? That's why you're not gonna do 2.
Mm-hmm.
Oh, okay. Yay.
Okay, everything else is live.
Ah, it's a live vaccine.
At 34 weeks gestation, the client reports constipation. They have been taking 325 milligrams of ferrous sulfate 3 times a day for anemia since the appointment 4 weeks ago. Which recommendations should the nurse make for this client?
Two and
Two, two,
three.
three. Twice daily. Why would they take lactaria? Unless they really need it.
No, they cannot take
I
less.
say that's what I say. No,
That's it.
that's it.
I think so. Oh yeah.
Okay, good. All right, I'm going to do one more maternity, and then I'm going to try to cover the rest of this cardiac because I got another group coming on in a little bit, maybe. We'll see if they jump in or not.
Wow.
Okay. Nurse is participating in an obstetrical emergency situation in which the healthcare provider announces shoulder dystocia. Which of the following interventions should the assisting nurse implement?
I think that's three. That's the Robert's maneuver.
4, 5.
5 additional staff.
Yeah.
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 That's it. Huh? They don't
Yeah, I
know.
think that's right. Go on.
4. So McRoberts maneuver, good job with that.
Wow.
So forceps are contraindicated here.
Okay.
Okay, so this is where we were talking about congenital heart defects. We went through transposition of the great arteries. And then risk factors for cardiovascular disorders. So this is 7 here. All right, so things that might be a risk factor for these children are congenital malformations, different types of genetic syndrome like Down syndrome, family history, any sort of drug or alcohol use by the mom, especially during pregnancy, or if the baby is born premature. Acquired cardiovascular disorders will be things like they maybe get from infections like rheumatic fever, Kawasaki's, or endocarditis. Please mute. They could also get cardiac issues from obesity, diabetes, again, drug or alcohol exposure,
Competence.
hypertension, chemotherapy, any other autoimmune disorders or endocrine diseases, organ transplants, or hypercholesteria, or too much cholesterol in the body, hyperlipidemia.
Miss Sue,
Yes.
are you gonna send us this recording?
Yeah, well, I sent you guys the other ones. You got those ones, right?
Yes. So I'm gonna have to leave. I'm sorry. So I'll see you tomorrow.
Okay.
Thank you. Bye, guys.
I just gotta
Hi,
throw my light
Suma.
on, guys. I can't see.
Suma. Oh, she left.
Oh, that's better. God said, let there be light. I'm sitting here in the dark. Okay, so we're going to measure pulse ox. We'll look at the EKG. We might do Holter monitoring, echocardiogram, chest x-ray, exercise testing, stress test, lab test, the CBC, BMP, C-reactive protein, urethral site sedimentation rate. We usually use that for things like autoimmune disorders, because that kind of measures the inflammation. We might do an arteriogram or a cardiac cath. So, you know, as far as the EKG, that's going to help us look at different cardiac arrhythmias and stuff. The cardiac cath might tell us, you know, if there was any sort of blockage, any sort of issue. The chest x-ray, that's going to tell us if there's any kind of like enlargement with the heart. The echocardiogram, that can tell us a couple of things. One, it can look at the injection factor, and it also looks at different like defects in the heart. The ejection fraction really kind of measures how the heart is pumping. And then exercise stress test, that can tell you how the heart functions under stress. That can be done with medication, or it can just be done on the actual treadmill. So with the EKG, you're looking at the different cardiac structures, all right, and different rhythms. And that can be used in kids to detect some cardiac issues. The ultrasound, the TEE, that could be used with the endoscopy, and that might be able to tell different changes within the heart. And then with the kids, you just would want to talk to them about it, let them know what you're going to do, why you're doing it. You might have to give them a mild sedative if they're not cooperative. All right, let's go on to another slide here. So what kind of medical treatments we might see for these clients? All right, supplemental oxygen. So depending on how well they're breathing, there's different forms. You already know that. They might need a nasal cannula, or they might even need something called a Venturi Mask. A Venturi Mask is something we can use on people with like COPD and that, to give them more of a higher concentration of the oxygen, especially if they have that automatic drive to shut off the breathing, that chronic hypoxia problem. Chest PT to get rid of the secretions. Chest tubes to help drain the pleural cavity and reinflate the lung if necessary, or a pacemaker. So if the child is undergoing cardiac surgery, we're going to monitor a few things. Temperature, okay? We want to monitor for fever. And if the child's immunosuppressed, you have to take that into consideration, because their temperature might not come up the way somebody else's is. So if they're severely immunosuppressed, you know, a temperature degree of 1 or 2 degrees can make a difference. Weight, we're looking at weight gain, because if your child's at risk for going into any sort of heart failure, all right, that's going to be your most accurate measure of fluid retention. So we definitely would want to take a look at weight gain. And then we're monitoring for things like edema, okay, around the legs and the ankles, clubbing of the fingers. Now, usually clubbing isn't something that's going to happen right away. That's something that happens over time. And then peripheral pulses, and we're measuring those pulses. So before surgery, you would want to have a baseline so that you can measure it against that baseline before and after surgery, so that you're looking for any different sort of changes. Auscultation, you're listening for the rate, the rhythm. any abnormal heart sounds like any murmurs, clicks, or rubs. And you should be listening and assessing that respiratory rate. Is there any increase in the work of breathing, any abnormal breath sounds or adventitious breath sounds? The nurse is assessing a child for cardiac disorders and documents the presence of clubbing of the fingers and toes. Which of the following conditions might that indicate?
Cyanosis.
I would say
Hypoxia.
hypoxia more than cyanosis, because cyanosis
Hypoxia.
is like how the skin turns once it's not getting good circulation. But hypoxia represents that chronic hypoxia is why that clubbing occurs usually.
Okay.
Okay. And it usually doesn't happen until after a year old. Okay. So again, when it's chronic, and that's going to be a sign of some sort of heart disease or something along that line. Heart failure. This can be a consequence of many congenital disorders. Okay. And so we're looking at the pathophysiology, what caused it, and then how are we going to manage it? So oxygenation, if the child needs it, supporting that cardiac function, meaning we want to maintain that heart within normal limits. We don't want to increase the workload of it, because anytime you increase the workload of that heart, it's going to put the child at more risk for failure. And then we want to give them adequate nutrition and promote rest. Give me just 1 second. I got to send a text message real quick. Okay, infective endocarditis. This can be caused by a few things, the valves being most common. And one of the reasons is because if it's artificial, okay, vegetation and stuff can grow around it, and that causes the bacterial infection to come in. It also can occur in the chambers of the wall or the septum of the heart. Again, increased with the prosthetic valves, because things like to accumulate around those artificial parts. And so we're going to use antibiotics. If the patient gets endocarditis, they're going to require antibiotics. Sometimes we'll do the prophylactic antibiotics for this, trying to prevent it before it happens, because once the patient gets that endocarditis, it can go through the body and really make them sick. So anytime they're going to have a dental procedure or anything like that, then we're probably going to go ahead and prophylactically treat for this. Let me just see what else I have on this that I might want to tell you guys about. Basically says the same thing, that the valve is the most common cause. You got to watch whenever you're going for dental or other procedures. Okay. The growths like to cover up those valve surfaces and cause necrosis to like the chordae tendineae, those little ropes that hold the leaflets there. And also they cause problems with the valve itself and can tear it down. So we're definitely always making sure that we're prophylactically treating anything that might cause the patient to get this type of an infection. All right, acute rheumatic fever. The diagnosis of this, and we saw this on a test question, right? Requires the presence of either 2 major criteria or 1 major plus 2 minor criteria from the Jones criteria. Okay, so major criteria would be the carditis, the polyarthritis, the subcutaneous nodules, the erythema marginatum, the Sydenham chorea, and then minor would be polyarthralgia, elevated urethrocyte sedimentation rate, and prolonged PR interval. All right, so that would show up on your EKG. See a lot of questions about the Jones criteria, so you're probably going to want to know about that. I'm sure you'll probably get some questions about it. Cardiomyopathy.
We need to write.
Okay. Risk factors for this are congenital heart defects, genetic disorders, inflammation or infectious processes, post-transplant, hypertension, Duchenne and Beckler's muscular dystrophy. And there's no reason known for it when it does happen. That's why it's referred to as idiopathic. It can lead to heart failure and cardiac arrest. A lot of times when people have this, they have kind of a poor prognosis. Kawasaki disease. We saw a lot of questions on this tonight, okay? You see a lot of this with these kids that have COVID or that were diagnosed with COVID, and it probably has to do with that inflammatory response, the inflammatory response. All right, so symptoms are going to be that high fever, chills, headache, malaise, extreme irritability, that strawberry tongue, they use that a lot. Desquamation of the perineum, the fingers and the toes, the vomiting, the diarrhea, and remember this can happen in different stages. So they have like the acute stage, the late stage, and depending on what stage they're in, on what you might see. So treatment for this is IV immunoglobulin and aspirin, and long-term monitoring of the coronary arteries. Mainly because they can have coronary spasms. So we always want to talk to the patient about when did the symptoms start, how have they progressed, what have you done at home, what treatments, medications, what sort of activity, okay, compared to their peers, meaning when I put this child next to another child that's 6 years old, do we see differences in their energy levels, in how they're able to function and get along with others, and how they're able to work and all, okay? Because they're going to have things like shortness of breath. They're going to get tired easily, even as an infant. All right, you might see sweating like around the head, and you might see the baby have poor feeding or tire out really easily. They might develop cyanosis, or you might even see them breathing abnormally with periods of apnea or breathing extra fast. So all these things that you're looking at as the nurse. What kind of history do they have? Why? Well, you already know things like rheumatic fever could lead to cardiac issues. They could have had some sort of trauma during birth or after birth. They could have had some sort of congenital malformation. They could have had an infection or a strep infection, a kidney infection, something like that that led to this. They could have chromosome abnormalities like Down syndrome, prematurity, okay, because the lungs aren't developed and other parts of the body aren't developed. and then autoimmune disorders, and then use of medications, or again, you know, the mom having an addiction problem and taking drugs or alcohol while she was pregnant. Family history of congenital heart disease. So you have to look at that further. The baby could have inherited something. Any sudden deaths in a young family member. You have to look at that Wolff Parkinson syndrome with this. Okay, we see this with a lot of young athletes where they suddenly die on the basketball court and they had a cardiac history and maybe it went unnoticed. Elevation in the lipids for some reason, diabetes mellitus. So what kind of things would you be looking at in the baby? You'd be looking at cyanosis. And again, that's going to present mostly around the lips, the earlobes, the fingertips, irregular heart rate. You have to know what's normal for an infant, okay? And you already know it should be like 120 to 160. What if they're 2? What if they're 3? Okay, when does the heart rate start to go to normal? Edema, specifically peripheral edema, that would indicate some sort of right-sided heart failure. If you saw that they were having problems breathing or problems with the lungs, any sort of lung congestion, then you'd be looking at some sort of left-sided heart failure. Clubbing of the fingertips, remember that's going to happen a little bit later. Okay, it takes time for that to happen. That's from chronic fevers, which might indicate like Kawasaki's disease or endocarditis. Retractions, remember where you're looking for those retractions at, in the substernal area. Okay, in the rib cages, between those intercostal spaces. How about nasal flaring, any sort of grunting? Prominence of a precordial chest wall, any visible or engorged or abnormal pulsations. Sometimes you can actually see the pulse beating somewhere, or any sort of abnormal abdominal distension. All right, for heart murmurs, you're listening and looking, where is it located? What does it sound like? How harsh is it? What's the variation of it? And then the intensity. If you look over here on the side, it tells you the different intensities. So you're going to want to know those. MedSurg 2, I'll be right with you. I just got 3 more slides to finish here. All right, so for the child with the cardiac disorder, what do we want to do? We want to get the O2 sats up. Again, there's a number of ways you might do that. You might have to use a non-rebreather if it's an emergent situation. You might be able to do it with a nasal cannula. All right, you might have to put them in a mist tent, especially if they're having other issues like pneumonia or something like that. Adequate nutrition. Why? Because when you have a cardiac problem, especially in these children, the metabolism's really high. So we want to make sure that we're giving good cardiac support with proper nutrition. All right, helping the baby and the family cope. Giving those post-op nursing care instructions. What should the parents be monitoring for? Okay, things like heart failure, infection, and giving that good education, okay, on the prophylactic antibiotics if they have a heart valve problem, if they have some sort of AFib, okay, and then what would you be treating them with, okay? If they have AFib or a heart valve, what would their PTINR be? Versus if they were on heparin, then you'd be monitoring the APTT and the platelets. So you should know what normal is and abnormal is for both. And when you would, what your level, your INR, remember between 2 and 3 for the AFib and between 2.5 and 4 for the artificial heart. Those hypercyanotic spells. Remember when the child has excess, they're using some sort of excess stress or some sort, like they could even be in the bathroom trying to take a poop. Okay, and it could cause this hypercyanotic spell where they're using this excess energy. Okay, so first thing is knees to chest, then the oxygen. Okay, where are they going to appear cyanotic at? Around those lips, those ears, those fingertips. And then other things, irritableness, restlessness. Okay, other things you're going to do morphine. Why morphine? It decreases the work on the heart. Okay, IV fluids if necessary. The baby might be dehydrated, and then propranolol to help protect the heart. Okay, it's a beta blocker. It's going to help. Psychosocial. Okay, parents are going to have some sort of feeling about this. Their child has a heart condition, and it's scary because the heart is the main thing that controls everything. All right, so you got to give them adequate time to ask questions, encourage them, and engage with them. All right, and then pre-op teaching. Okay, for these patients, teach them about how the heart functions, about what to expect before and after surgery, where the incisions and stuff are going to be made, and what kind of care you would expect them to do after surgery. Also, are there going to be any changes in the way the child acts or looks after that surgery? And after surgery, what kind of rest is this child going to need? Can they go back to normal activities? Will they have certain restrictions? And then if they are a cardiac patient, okay, they're going to have certain restrictions. They might have fluid restrictions. They might have sodium restrictions. They might have restrictions on those lipids if their lipids are running high a lot. So those are things that you're going to have to look at. And then what about medications? Digoxin, antibiotics for the prophylactic endocarditis. What other kind of cardiac meds might you see on these patients? Beta blockers. So those are all things that you're going to have to know about as the nurse. Questions? All right, OB and Ps, good luck.
Thank you. Have a good night.
Welcome. Okay, we got
Thank you.
two in the house. You're welcome.
Stop making noise.
You guys are working on neuro, musculoskeletal, and what else?
Immune and cancer.
Okay. So let's, what I'm going to do is I'm going to break them out into sections, because the other night we were going over some, but then we were using Saunders. I'm going to use a little bit of UWorld, and let's just try to break them out. We go like neuro, then musculoskeletal, then immunity, then the oncology. So this way we're not mixing too much stuff up at once, and we can kind of try to stay focused in one or two areas. Give me a second to change up the screen here. Thought I was already in UWorld. I have no idea where it went to. But it fizzled out on me. All right, I'm going to open it back up. I like UWorld because it's going to bring you a lot of knowledge about different subjects. As you read the questions, it gives you a lot of content. So it's just a good learning tool for me to reinforce stuff with you guys. So we will start with a little bit of neuro. That's the thing that you had the longest time ago, right? And then we'll work towards the musculoskeletal, the oncology, and the immunity, which is the new stuff you guys should be working on, if I'm right. Okay. So let's just start with 20 of these and see how you do. Let me know when you can see the screen.
Yes, I can see.
Okay, a client is being admitted for potential cerebellar pathology. Which tasks should the nurse ask the client to perform to assess if cerebellar function is within the defined limits?